I'll explain and demonstrate our lateral retractor system, and our PathLoc P lateral retractor system has some several parts. So first one is this is the main frame. This is the main frame is most important instrumentation, and also this part is kind of some connecting rod part into the patient's bed, and also it has some universal the joint that it can be freely seated the right position, and then this part must be inserted with this main frame, and then so fix a barrier. And also this is also the old braid part. So braid has a lot of length option, so surgeon can choose the right the braid length for the some after dilation. And this is a shim. Shim is also additional some equipment for the attaching into the braid the tip, and then it has some styrene pin or the K-wire shape, and it has some braid into the disc annulus, and this is extension of the braid, kind of wider braid, and then some more length braid here, and this is a post braid. Also, I will start with some according to the surgical procedure. Surgeon can use this targeting device. This is some long handle for the surgeon have the less exposure of the radiation, and then into the on the skin, image intensifier. Surgeon can check the right disc, and then right position for the portal site, and then mark with a skin marker. After them, surgeon used the GMC needle and insert the guide wire, and then through the guide wire start with the first dilator. And you can see the two holes. Central hole is a guide wire channel, and second hole is a neuromonitoring probe can go inside here, and then check the monitoring. After the first dilator, second dilator going through the first dilator. Also, second dilator has another hole for the neuromonitoring probe. After the second dilator is going through and the seated, also you can check the right length. Maybe from the disc space for the some length is maybe for example 130 millimeter. The right length is 150. 10 or 20 millimeter more length will be appropriate. So we choose the 150. So braid has some 3-in-1 set. So you can see the central and right and left. So central must be attached here. You can R right here, left here. So you can start with the central with a push with the handle, and you can see hear the click sound right here as well, left here as well. And also this lever is a central braid, some extension distraction, clockwise turn distract, anti-clockwise it is compress, so you can making a complete hole with this lever. So with like this type, you can making a complete another braid set and go into the second dilator. You can insert the 3 braid set, and after that you can remove the first and second dilator. And this is going through the skin to the some right end of the disc space. After that, also all this part is sterilized, and then maybe you ask to the scrum nurse to deliver it to a sales rep or some circulating nurse. So after circulating nurse got this part, maybe if you imagine this is kind of a frame of the patient's bed, most important part is this screw part is bottom, so this is up. So you insert it here and lock the screw from the down, and also you ask to the deliver this load end to the some circulating nurse, and circulating nurse or the sales rep remove this screw. This screw is kind of anti-proud, so you this part must be handled by the scrum nurse, and only this part is handled by the circulating or the sales rep. You tighten and then you rock the screw here as well. Once this frame is attached with the patient's bed, you can see this universal joint. You can making a very free position, and then it must be attached with this frame. It has a same two hole, but I recommend to attach it this main body part. Also push it, and then you can rock with this lever, and then making right position. Also you rock this second lever. There is some older frame is some setter, and also you can see maybe you grab this lever, the right and left blade is extended like this, and once extended, and then you can lock with this screw. And then as I mentioned, maybe if you turn it clockwise, central hole is extended again. So surgeon are making a very good extension of the some retractor system. And then once it is decide also that with this push button and remove the handle for making a better space. And also you can use this screwdriver for the tighten, or and also you can clockwise this lever. You can see that this blade is diversion, anti-clockwise is conversion. This one as well, you can see diversion of this left blade and inversion of this left blade. And also, if the surgeon wanna, our system has the 3-blade system, but if you wanna another 4th blade option, you can attach this black plastic arm here, and surgeon can choose wider or narrow or post braid. It has also the 2 lengths. Is the shorter length is 160, and the longer is 210. So you can choose any post braid and then insert it here, and then also you can fix with this lever or this screwdriver. And we have this is also another important instrument. This is a holder for the shim. If you use the pin shim, also you can see that this up position, with the up position you click it and then you push is lock, and then trigger is unlock, lock, unlock, locking, and then you can see the very firm picture of this one. And you can see that this rail must be go through the some very small narrow part of the this main braid. So maybe the central braid part is kind of the bony size. Also you can insert this Steinman pin here, insert it, or some impacting and unlock and remove. So this is a pin. Also if you wanna fix it with the kind of disc space with the braid, same as well. Also you can use the kind of the wider the subsidiary the braid. Also you can insert and lock, and you can go through this right or left braid rail and unlock and remove. This is main frames, there's some completion, and also we have an option for some risers here. We supplied some risers cable, and risers cable has some end, and then we have several adapters. So maybe any some generator in the hospital, so we can find some option, and then you can connect with some generator. And maybe it is a double risers. It can be used this post braid hole like this, and you can see the kind of better the bright side. That's all of our the complete system. And also we have another some subsidiary. This is a very long suction tip. This is a bipolar tip, and also this is a knife handle, and also we double side the pen field, longer one. This is our all of our subsidiary instrument.